So Nara, if you would be willing to talk a little bit about some of the challenges that your folks face with dating, specifically around disclosure, because it is something that folks need to learn to live with long term. And hopefully if it's part of what they want, they're dating and they're getting to meet people. And so just some of the challenges that they're facing, and then maybe how, if you know, how they'd make that decision to disclose.
That's a loaded question. Definitely. I mean, when I first started, I had a caseload about 50 to 60 patients, right? And they kind of all range from like elementary and middle school kids all the way to high school. I had a couple of college kids. And so definitely when they, hit puberty, is when we, well, they start getting interested in boys or girls or none at all. They could be asexual, but we start kind of poking and prodding about what their thoughts and feelings are about who they're interested in, right? And I think dating in general is hard enough as it is, right? Like rejection, wanting the person to love you, and I think innately as humans we just want to be loved and cared for, and so with all that being said, then you interject this like stigmatized diagnoses on there. Like it makes it immensely more like challenging. And I mean, I had a patient of mine dated her boyfriend for about 7 years and she did not disclose to him. And and I was with her when they started first dating, and we're like, hey, you have to tell him, like, because we knew that they were sexually active and that sometimes they didn't use condoms, and that also she wasn't really taking her meds every single day, and so her viral load would blip up here and there. And so we were really concerned because we're like, hey, like, if you need help, we are here. Like, we've had kids bring their partners. I've done role plays with them. We've practiced, like there's little nuances that they can do to kind of gauge the trust factor and how like their partner may or may not react to, right? And there are little scenarios that like I've kind of developed and also gathered together from other patients in the past, and kind of I have this little toolkit that I can kind of talk to my patients about. But I think the biggest things is I wrote down here, how do I even bring up the topic, right? This is the thoughts, right? Do I tell them on the first day? Do I tell them on the third day? Do I tell them right before we're about to have sex? Like, is that like a mood killer? How do I condom negotiate? Like that is a big thing, especially with our teenage females, is condom negotiation, right? And oh, I've already had sex with them. What if they get mad if I tell them now? So like for that example, my patient, it was like 1 year in, then it was 2 years in, then 3, like the longer it goes, the pressure of like, and it just went on for like 7 years. And to this day, I don't think he, ended up contracting HIV. And she ended up finally telling him. And, because they kind of had an off and on kind of relationship for 7 years, and it was fine. And he ended up telling her, oh, I have an uncle who actually had HIV and he passed away a long time ago, before, medication was, as good as it is now. But she was shocked. And he was like, why didn't you tell me earlier, right? And she kind of told him, it's because I was scared. And rightly so, because we've had situations where I had a patient of mine, she was dating this guy. His mother was a DC police officer. And so she ended up telling him, and he got so upset and started threatening her. And even though they had sex, but they used the condom, it didn't break or anything. And he went and got tested, but her family was so afraid for her life that they sent her down to North Carolina because they were so afraid, and so again, it's that stigma and people just not being educated on. And the thing is, she took her meds, she was undetectable. The likelihood of her infecting him was like 0.0001%. And so, but even with that, people just, go from, 0 to 60 or 0 to 100 at that like anger level, right? And I need to also talk about there's a specific dynamic between perinatally infected patients and horizontally infected. So when I say perinatally, these are patients of mine that were born with it because of numerous reasons. A lot of it was when their mothers were pregnant with them, they just weren't aware that they were positive, and that's a vertical transmission. Horizontal, or previously called behaviorally infected, is later in life. Kids in their teenage and young adult years will have sex and they end up getting it. And so I had a patient of mine. I met her when she was 23, but she told me that she got infected when she was 18. And she told me she was a really naive 18-year-old, and she ended up getting her first boyfriend when she was 18. She was a senior. He was a freshman in college. Like this older guy. He was into her. He adored her. She had all these butterflies, and in her head, she was just like, oh, this is gonna be my first time. And when she was always told and educated, at school, like you should use a condom, right? And so she said she brought that up to him, but he was like, oh, I don't like how that feels. So, like if you want to use a condom, then, I don't have sex, I don't have sex with women that want to use condoms. And so for her, in that moment, you don't want to be like, okay, I guess, we're not going to have sex, right? Like if you're already in that, anticipation. And so she was like, well, I guess it's not a big deal. So they ended up having sex without a condom. And then he ended up, quote unquote, ghosting her later on. And several weeks later, she got cold-like symptoms. It wasn't going away. So she was like, okay, I'm going to go see my primary care doctor because maybe it's like, I have pneumonia or bronchitis or something, right? So she went. The doctor just did a preliminary like blood work, and then doing a good sexual history is so important. And I feel like a lot of doctors, especially I think with pediatricians, you see the kids kind of grow up and they're kind of like a parental figure. So when, as a pediatrician, having the sex talk with one of their patients that they've known since they were a wee little thing, it can be really awkward. And so I think, she was able to get a sexual history from her. She found out she had sex. It wasn't without a condom. So this doctor had oh my God, the mindset to be like, let's do an STI panel, all of it, right? And that's when it came back positive. And, going back on like the myths, right? It's the fact that like people think, oh, if you have HIV, then you have sex a lot, or you like that, you promiscuous, right? It only takes one time. Same thing with getting pregnant. It only takes one time. And I think people forget that a lot of times. And with this patient of mine, she said it was just one time. And going forward, she was telling me, I asked her like, okay, so like, how's your dating life been since then, right? And she said, I disclose my status first or second date, hands down. Like it's non-negotiable for her. And she said that, yeah, it's very scary, but at the same time, she knows what it's like to be on the other end, to be on the other side of that person might have known that he was positive, or maybe he didn't know, right? And he unintentionally infected her, right? But one way or the other, for her, she said that she feels like it's her responsibility to disclose because she would never want another person to feel like how she did. And, I asked her, okay, so has it been a good experience for you, right? And she said, actually, she's disclosed to 3 different guys. And the most recent guy that she had disclosed to she ended up telling him unintentionally on the first date. They were at like a Denny's, right? And they're just chit-chatting, and they just started talking about like, their parents and health issues in general. And she just kind of blurted it out and was like, okay, I have HIV, but just to let you know, I'm on medication, I'm undetectable. And she says she does a lot of, education around that too. So not only are my patients disclosing, but they're also educating their partners too on top of that. So it's like, it's a lot to it's a lot of burden on their shoulders to kind of take on, but I'm quite proud of them that they're able to do that. And so yeah, it's really hard, and that's one of the many stories that I have.
I just keep thinking, and this is just the problem with me being an educator, is I just keep thinking like how much easier people's lives would be if they didn't have to if they didn't have to be the one doing all the education. And I don't have the numbers in front of me. We'll probably do a follow-up piece on this, but in 2021, there are still states that don't mandate HIV education. And it's hard for me to grasp, because what we're doing is we're making people who have HIV, we're making their lives that much harder. Like, yeah, your clients would probably have to go into a little more depth about what does it mean to be, undetectable, but if we could have just helped that person out a little bit by making sure the people around them have that knowledge. So that's just where I keep going back to as an educator. Like, we're failing so many people by not doing better. But Sabrina, you were going to jump in.
Well, I think from a social work standpoint as well, like what really touched my heart is the fact that, Nara, you actually go through the scenarios with your patients, and that there is that support, and that you've developed that almost curriculum, because I think so much of that stigma and all of these swirling thoughts is like, how am I going to tell someone? And having a safe person and organization that, someone who does have this diagnosis can go to and sort of practice this is huge. And being able to walk through any barriers or anxieties or whatever. And again, it would be helpful if there was sex education so that it wasn't that much more of a burden. But I would hope that anyone listening to this, if they do have an outlet within their organization and that they're not showcasing, or they don't have that opportunity to work with clients or those individuals diagnosed in that way, doing the role plays, like I think that's was very profound. I so appreciate this conversation. We both very much appreciate this, and there is much more to come, so continue to stay tuned.